Welcome back to the Uprise Doctor to Doctor series, Documentation Best Practices. We're going to review a best practices approach to glaucoma suspect. Hi, I'm Kim Castleberry, and I'm happy to share my thoughts from the perspective of a 25-year veteran Medicare auditor and the primary design consultant for Uprise EHR. I hope the next few minutes reviewing glaucoma suspect is helpful in streamlining your practice efficiency and get you home quicker. CMS guidelines dictate medical necessity should be directly stated or easily implied in the medical record. Years of Medicare audits has taught me what is easily implied by one auditor is not by the next. So I learned to both directly state and easily imply medical necessity, and I've never failed an audit. I'm also happy to tell you that I designed Uprise to support automatic documentation of medical necessity. Starting with the exam chief complaint, the primary reason for the visit can be selected and designated. PFSH supports past ocular and family ocular history and can be automatically updated from the patient questionnaires. Vitals support IOP, IOP graphs, cup-to-disc ratios, and pachymetry findings. Physical exam supports treatment code mappings that automate findings, assessment, plan, orders, procedures, counseling, and coding with a single severity-based ICD selection. Mild selects supportive treatments, moderate selects additional special testing treatments, and severe selects additional surgery or referral treatments. We call it Smart Touch. It's an industry first and has built-in clinical decision support at the point of care. Physical exam supports glaucoma ICD favorites for easy selection. And orders, counseling, and coding are automatically displayed with Smart Touch, making medical necessity both easily implied and directly stated. So let's jump into the EHR and look at a glaucoma suspect exam. Looking at a glaucoma suspect evaluation, I like to go to the exam tab right here and get a quick preview of what I'm walking into when I walk into the exam room. I can see here that the patient's coming in for a glaucoma suspect evaluation under visit reason, and under exam type it's a new comprehensive exam. So I'm going to go over and jump over to the summary tab and get a preview of the data that's already been collected on the patient. And of course there are no future orders because the patient's never been in before. If the patient's been in before, any orders that you've written in past orders will be right here. We can take a look at their quick refraction history, their medication history, and we can go over to active problems and see what's already been managed during the refraction portion of the exam that's already been completed by the technical staff. And we can see our vitals tab here with pressures of 28, blood pressure. We've already got some cup to disc ratio data already here for us that's been input by the staff. And we can also see acuities, height, weight, pachymetry findings right here. So now we've got a pretty good idea of what we're walking into. So let's go ahead and jump into the exam. And we can see here at the chief complaint that the staff's already input. The glaucoma suspect evaluation is the primary reason for the visit, and they've got blurred reading vision in addition. So let's look at PFSH. You can see here that Uprise supports questionnaires that have already been completed either online or even in the practice online. You can pre-populate the form with that, and we can see here that the patient has a personal history of cataracts in glaucoma suspect, and they don't have any history of anything else there. They've got a family history of cataracts and glaucoma. So let's review that. And we can see here that it's directly stated the family history. Now, looking down to allergies, we have no known allergies. We've got a couple of medications here. Looking at the vitals tab, we've got acuities, and we've got our pressures right here. So we can see our pressures are at 28.5 and 29. You can also see here there's a place for target pressures if you're actually treating glaucoma, and you can see our pachymetry findings right here. And the cup to disc ratios have already been input by the staff from the OCT findings. They have standing orders to go ahead and get certain special tests like OCT when we're doing glaucoma or glaucoma suspect evaluations. We've got our pupil findings here, our general and constitutional items here, and we can see here that we've already got a Optomap done right here, and wavefronts have already been done right here. We've got keratometry here, and we've got our refractions that have already been completed here. Binocular testing is here. So we're ready to do the medical portion of the exam. So we're simply going to go to category selection, and we're going to select glaucoma. And we've already examined the patient, determined everything else is normal. So we're going to select everything else is normal and process this screen. So here you'll find that we've got favorites for glaucoma and glaucoma suspect right here, starting with retinal nerve fiber layer defects in the borderline glaucomas, anatomical narrow angles, steroid responders, ocular hypertension, and so forth. So in this case, we've got moderate ocular hypertension, and we've got moderate high risk open angle glaucoma. So we just finished that, and look what happens. Our findings are already documented here. We have an assessment that's already been placed here, and we're going to go ahead and select high-risk open-angle glaucoma as the primary diagnosis. And we're going to go down to orders, and we can see here orders for moderate ocular hypertension and moderate open-angle glaucoma. So we've already done an Optomap, so we really don't need to do fundus photos, but we can go ahead and need to do OCTs of the nerve, a visual field, and pachymetry. You can see it already completes the interpretation and reports and does billing and coding here for automatically. Let's go look at visual field, in fact. We'll see here that the interpretation and reports already done with the reason for the test, the ultimate diagnosis. If you want to fine-tune reliability and fine-tune the plan, you can, but it's already done for you. And we go down to patient counseling, and based on your diagnoses and your problems, it gives us some patient counseling items. So let's go and educate them about glaucoma, ocular hypertension, and fundus photography, and OCT. Now we can go down here in the coding to see that our exam has already been linked to our primary reason for the visit and the diagnosis, and assigned to the Medicare insurance. The refraction has been assigned to the patient, and the OCT, visual field, and fundus photography findings, the pachymetry, have been assigned to the correct diagnosis and the correct insurance company as well. And we can see here Optomap has been billed to the patient. So we simply are done here. So you can see we have directly stated everything that we want to do here, or it certainly has been easily implied medical necessity for both the visit and all of the special testing. All we have to do now is just sign the exam, close the exam, and go home. We're done. That's it for glaucoma suspect. I hope this helps your best practices effort. Look for other conditions in Uprise training or on YouTube, and feel free to contact me at my email listed here. I'm happy to help. Thanks for watching. See you in the cloud.